Hi, my name is Kim Bednar. I'm a family nurse practitioner and serve as the Government Relations Chair for the Virginia Council of Nurse Practitioners. We've all had to make adjustments in how we provide safe and comprehensive patient care during the COVID-19 pandemic. One change is offering telemedicine appointments for our patients. The Coronavirus Preparedness and Response Supplemental Appropriations Act was signed into law by the President on March 6, 2020. This act allowed the Secretary of the Department of Health and Human Services to waive certain Medicare telehealth payment requirements during the public health emergency and has allowed beneficiaries in all areas of the country to receive telehealth services. The Virginia Department of Medical Assistance Services, or DMAS, Virginia State Medicaid Agency, has expanded telehealth coverage and flexibility in the delivery of care through telehealth. DMAS has waived the existing requirement that telehealth services be done in real-time platform with audio and visual connections. This has allowed the use of audio-only care and care provided over the telephone. Until further notice, Medicaid is not requiring the provider to bill using telehealth codes only, but is allowing the use of CPT and HCPCS codes. This allows for the same reimbursement as in-person encounters. DMAS is also allowing the delivery of behavioral health services through telehealth, including service needs assessments and addiction, recovery, and treatment services for opioid use disorders and outpatient psychiatric services. Furthermore, Virginia state law requires telehealth visits to be reimbursed at the same rate as in-office visits by commercial insurers. This waiver will stay in effect until the public health emergency ends, as declared by the Secretary of the Department of Health and Human Services. In order to ensure you are complying with current regulations, the Virginia Council of Nurse Practitioners would like to share some tips for telehealth visits in Virginia. Any licensed healthcare provider may conduct a telehealth encounter. Providers can use any non-public facing audio or remote communication products. During the telehealth encounter, the provider must verify the patient's identity and location. The patient must be a resident of Virginia. The provider must orally identify themselves and disclose their credentials if they do not have a pre-existing relationship with the patient. Oral consent must be obtained for the telehealth encounter. Documentation should include the provider's credentials, the patient's consent for the telehealth remote visit, the description of the services that will be provided during the encounter, the patient's acknowledgement that the provider will determine whether the visit should occur via telehealth, the security around the telehealth platform being used, and the privacy risk, the patient's consent to provide private health information from the visit to a third-party provider, the patient's agreement to hold the provider harmless if any information is lost due to technical failures. During the public health emergency, penalties will be waived for HIPAA violations against healthcare providers that serve patients in good faith. The visit is otherwise conducted in the same as an in-person visit, with one exception being prescribing Scheduled 6 controlled substances. To prescribe Scheduled 6 controlled substances via telehealth, there must be a bona fide practitioner-patient relationship. The prescribing provider must review the patient's medical history and update it at the time of prescribing, make a diagnosis at the time of prescribing, and satisfy all applicable standards of care. Please confirm with your healthcare clinic or institution if there are any additional documentation and credentialing requirements for prescribing Schedule 6 controlled substances. Telemedicine appointments allows healthcare providers to continue to offer exceptional care, especially to our most vulnerable and isolated patients. I hope you find this information helpful, and the VCNP hopes you and your families are staying safe and healthy. Thank you.